Question 1. Before approaching a collapsed person, what is the most important action a rescuer should take? A. Check for a pulse. B. Open the person's airway. C. Ensure the scene is safe. D. Begin chest compressions. Answer: C. Ensure the scene is safe. This question tests the foundational concept of scene safety, which is the very first step in any emergency. The keyword "most important action" highlights that personal safety is paramount before providing care. Before you can help someone, you must make sure the environment is safe for both you and the person in need, preventing further injury or becoming a victim yourself. For example, if someone collapses in the middle of a busy street, you wouldn't rush in until traffic is stopped or the person can be moved to a safer location. Always remember, your safety comes first, so look before you leap. Question 2. When performing CPR on an adult, what is the correct compression depth? A. At least 1 inch 2.5 centimeters. B. Approximately 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. No more than 2 inches 5 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question focuses on the critical skill of delivering effective chest compressions for adults. The concept here is the optimal depth needed to circulate blood effectively to the brain and other vital organs. Compressions must be deep enough to be effective, but not so deep as to cause injury. For an adult, aim for compressions that are at least 2 inches deep but not exceeding 2.4 inches. Think of it like pushing down firmly on the center of the chest, allowing the chest to fully recoil between compressions. A good way to visualize this is to imagine pushing the chest down by about a third of its depth. Question 3. What is the correct rate of chest compressions for an adult during CPR? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question evaluates your knowledge of the correct compression rate, a key component of high-quality CPR. The concept is maintaining a consistent, fast pace to ensure continuous blood flow. The correct rate for chest compressions on an adult is between 100 and 120 compressions per minute. A helpful way to remember this is to compress to the beat of a song like "Stayin' Alive" by the Bee Gees, which has a rhythm within this range. Delivering compressions at this speed helps maximize blood circulation and improve the chances of survival. Question 4. After performing 30 chest compressions on an adult, what is the next step in the CPR sequence? A. Check for a pulse. B. Deliver 2 rescue breaths. C. Apply the AED pads. D. Call for advanced medical help. Answer: B. Deliver 2 rescue breaths. This question tests your understanding of the compression-to-ventilation ratio for adult CPR. The concept is about maintaining the correct sequence of compressions and breaths. After completing 30 high-quality chest compressions, the next step is to open the airway and deliver 2 rescue breaths. This 30-to-2 ratio is standard for a single rescuer performing CPR on an adult. For example, if you just finished pushing down on the chest 30 times, quickly switch to tilting the head back and giving 2 breaths. Always remember to follow the CAB sequence: compressions, airway, breaths. Question 5. How long should you check for a pulse on an unresponsive adult? A. No more than 5 seconds. B. At least 10 seconds. C. No less than 5 seconds and no more than 10 seconds. D. Only if the person is not breathing normally. Answer: C. no less than 5 seconds and no more than 10 seconds. This question assesses your knowledge of the time limit for checking a pulse, a critical assessment step. The concept here is efficient and timely assessment to avoid delaying chest compressions. When checking for a pulse on an unresponsive adult, you should take at least 5 seconds but no more than 10 seconds to make a determination. Taking too long delays life-saving chest compressions, while too short might lead to missing a faint pulse. For instance, feel for the carotid pulse in the neck, counting 1001, 1002. Up to 10 seconds. If there's no definite pulse or if you're unsure, assume no pulse and begin CPR. Question 6. What is the purpose of an automated external defibrillator, AED? A. To stimulate breathing in a person who has stopped breathing. B. To measure blood pressure and heart rate. C. To deliver an electrical shock to reset the heart's rhythm. D. To provide oxygen to the brain. Answer: C. To deliver an electrical shock to reset the heart's rhythm. This question targets the fundamental function of an AED. The concept is defibrillation, which is the delivery of a controlled electrical shock to a heart in cardiac arrest. The AED is designed to analyze the heart's rhythm and, if necessary, deliver an electrical shock to correct specific life-threatening arrhythmias, such as ventricular fibrillation. It's not for breathing or blood pressure, but specifically for resetting a chaotic heart rhythm. For example, if someone collapses suddenly and is unresponsive, the AED helps restart the heart to a normal rhythm. Remember, an AED helps shock the heart back into action. Question 7. Where should AED pads be placed on an adult? A. One pad on the left shoulder and one on the right hip. B. One pad on the upper right chest and one on the lower left side of the rib cage. C. Both pads on the center of the chest. D. One pad on the forehead and one on the stomach. Answer: B. One pad on the upper right chest and one on the lower left side of the rib cage. This question tests the correct placement of AED pads on an adult, which is vital for effective defibrillation. The concept is ensuring the electrical current passes through the heart. For adults, one pad should be placed on the upper right side of the chest, above the nipple, and the other pad should be placed on the lower left side of the rib cage, below the armpit. This specific placement ensures the electrical current travels across the heart. Correct pad placement is crucial for the AED to work properly and deliver a life-saving shock if needed. Question 8. What is the first step you should take when a conscious adult is choking and cannot speak, cough, or breathe? A. Perform chest compressions. B. Administer rescue breaths. C. Encourage them to cough forcefully. D. Deliver abdominal thrusts, Heimlich maneuver. Answer: D. Deliver abdominal thrusts, Heimlich maneuver. This question focuses on the immediate action for a conscious choking adult. The concept is recognizing severe airway obstruction and applying appropriate intervention. If a conscious adult is choking and shows signs of severe obstruction, like inability to speak or cough, the first step is to deliver abdominal thrusts, also known as the Heimlich maneuver. This involves standing behind the person and delivering quick upward thrusts to the abdomen to dislodge the object. For instance, if someone at dinner suddenly grasps their throat and can't speak, you would immediately begin abdominal thrusts. Remember, if they can't breathe or make noise, it's time for intervention. Question 9. When should you activate the emergency response system, call 911 or your local emergency number, for an adult victim who collapses suddenly? A. After performing 2 minutes of CPR. B. As soon as you determine the person is unresponsive. C. Only after an AED is available. D. After checking for a pulse and breathing for 30 seconds. Answer: B. As soon as you determine the person is unresponsive. This question addresses the crucial step of activating emergency medical services in a timely manner. The concept is call first, fast, for adult sudden collapse. When an adult suddenly collapses and you determine they are unresponsive, the emergency response system should be activated immediately. This ensures that advanced medical help is on its way as quickly as possible. For example, if you see an adult suddenly fall to the ground and they don't respond when you tap and shout, your immediate action after checking responsiveness is to call for help. Don't delay calling 911. Early activation saves lives. Question 10. You are performing CPR on an adult and an AED becomes available. What is the next step? A. Continue CPR for another 2 minutes before using the AED. B. Stop CPR immediately and apply the AED pads. C. Deliver one shock without pausing CPR, then resume CPR. D. Use the AED as soon as it is ready, minimizing interruptions to CPR. Answer: D. Use the AED as soon as it is ready, minimizing interruptions to CPR. This question tests your ability to integrate AED use into ongoing CPR. The concept is minimizing hands-off time during CPR. When an AED becomes available, the priority is to use it as soon as it's ready, ensuring you minimize any interruptions to chest compressions. You should stop compressions only long enough to apply the pads, allow the AED to analyze, and deliver a shock if advised, then immediately resume CPR. For instance, if you're doing CPR and someone brings the AED, quickly attach the pads while others continue compressions if possible, then follow the AED's prompts. Remember, every second without compressions reduces the chance of survival. Question 11. What is the recommended hand placement for chest compressions on an adult? A. On the lower half of the breastbone. B. On the upper half of the breastbone. C. On the xiphoid process, tip of the breastbone. D. On the sternal notch, top of the breastbone. Answer: A. On the lower half of the breastbone. This question focuses on the correct hand placement for effective chest compressions. The concept is ensuring the force of compressions is applied to the most effective and safest part of the chest. For adults, the correct hand placement is on the lower half of the breastbone, also known as the sternum. This position allows for optimal compression depth and minimizes the risk of injury to other organs. For example, find the center of the chest, then place the heel of one hand there with the other hand on top. Proper hand placement helps deliver high-quality compressions. Question 12. If a victim has a suspected head or neck injury, what is the preferred method for opening the airway? A. Head tilt chin lift. B. Jaw thrust maneuver. C. Leave the airway as is. D. Place a pillow under the head. Answer: B. Jaw thrust maneuver. This question addresses a critical modification for airway management in specific injury scenarios. The concept is to open the airway while minimizing movement of the neck or spine. If a victim has a suspected head or neck injury, the jaw thrust maneuver is the preferred method for opening the airway because it helps to open the airway without extending the neck. This technique reduces the risk of further spinal cord injury. For instance, if someone fell from a height or was in a car accident and is unresponsive, use the jaw thrust to open their airway. Always prioritize spinal precautions if a head or neck injury is suspected. Question 13. What is the universal compression to ventilation ratio for single rescuer adult, child, and infant CPR? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 5 compressions to 1 breath. D. 20 compressions to 2 breaths. Answer: B. 30 compressions to 2 breaths. This question tests your knowledge of the standardized compression to ventilation ratio. The concept is maintaining a consistent rhythm for CPR across different age groups when only one rescuer is present. For single rescuer adult, child, and infant CPR, the universal compression to ventilation ratio is 30 compressions to 2 breaths. This ratio ensures that blood circulation, compressions, is prioritized while still providing necessary oxygen, breaths. For example, whether you're performing CPR on an adult or a baby by yourself, the rhythm stays the same, 30 pushes, then 2 breaths. Question 14. What should you do if an unresponsive adult victim has a pulse but is not breathing normally? A. Begin chest compressions. B. Deliver rescue breaths at a rate of 1 breath every 5 to 6 seconds. C. Place the person in the recovery position and wait for EMS. D. Attach an AED immediately. Answer: B. Deliver rescue breaths at a rate of 1 breath every 5 to 6 seconds. This question assesses the appropriate action for a victim with a pulse but inadequate breathing. The concept is providing rescue breathing when circulation is present but ventilation is not. If an unresponsive adult victim has a pulse but is not breathing normally, you should deliver rescue breaths, 1 breath every 5 to 6 seconds. This provides oxygen to the person while their heart continues to circulate blood. For instance, if you check for a pulse and find one, but the person is only gasping or not breathing, you would provide slow, steady breaths. Remember, if there's a pulse, focus on getting oxygen into their lungs. Question 15. What is the recommended depth of chest compressions for a child? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. Answer: D. Approximately 1/3 the depth of the chest, about 2 inches 5 centimeters. This question tests your knowledge of appropriate compression depth for pediatric victims. The concept is tailoring compression depth to the child's body size. For a child, the recommended depth of chest compressions is approximately 1/3 the depth of the chest, which usually translates to about 2 inches 5 centimeters. This depth is crucial for effective blood circulation without causing injury. Imagine pressing firmly enough to achieve this specific depth, ensuring adequate pressure for the child's smaller frame. A good rule of thumb is to push about 2 inches deep. Question 16. What is the recommended depth of chest compressions for an infant? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 1/3 the depth of the chest, about 1.5 inches 3.8 centimeters. Answer: D. Approximately 1/3 the depth of the chest, about 1.5 inches 3.8 centimeters. This question focuses on the specific compression depth for infants. The concept is adjusting compression depth for the smallest patients to ensure effectiveness and safety. For an infant, the recommended depth of chest compressions is approximately 1/3 the depth of the chest, which is about 1.5 inches 3.8 centimeters. This ensures blood is circulated effectively to vital organs while considering the infant's delicate size. For example, use 2 fingers or 2 thumbs to push down on the infant's chest just below the nipple line. Remember, it's about pushing deep enough but not too deep for their tiny bodies. Question 17. How should you open the airway of an infant during CPR? A. Head tilt chin lift past sniffing position. B. Jaw thrust maneuver only. C. Head tilt chin lift to a neutral or sniffing position. D. Do not open the airway, just give compressions. Answer: C. Head tilt chin lift to a neutral or sniffing position. This question addresses the correct airway opening technique for infants. The concept is creating an open airway gently without overextending an infant's flexible neck. For an infant, the airway should be opened using a head tilt chin lift to a neutral or sniffing position, meaning the head is not tilted back too far. Overextending an infant's neck can actually close their airway. Imagine how an infant might sniff the air. That's the correct gentle head position. This gentle positioning ensures the infant's delicate airway remains open for rescue breaths. Question 18. What should you do if an infant is conscious and choking but can still make some noise or cough weakly? A. Immediately perform back blows and chest thrusts. B. Encourage the infant to cough strongly. C. Begin CPR. D. Call 911 immediately. Answer: B. Encourage the infant to cough strongly. This question assesses the appropriate response to a conscious infant with a mild choking obstruction. The concept here is recognizing a mild airway obstruction and allowing the infant's own protective mechanisms to work. If an infant is conscious and choking but can still make noise or cough weakly, you should encourage them to cough strongly. This indicates a partial obstruction, and their own cough is often the most effective way to clear it. For example, if a baby gags and coughs after putting something in their mouth, let them continue coughing as long as they are effective. Only intervene with back blows and chest thrusts if the coughing becomes ineffective or stops. Question 19. When performing CPR, how often should you switch roles with another rescuer to prevent fatigue? A. Every 5 cycles or about every 2 minutes. B. When you feel tired. C. After every cycle of 30 compressions and 2 breaths. D. Only if the first rescuer asks to switch. Answer: A. Every 5 cycles or about every 2 minutes. This question addresses a key aspect of team-based CPR. The concept is managing rescuer fatigue to maintain high-quality compressions. To prevent fatigue and ensure consistent, high-quality chest compressions, rescuers should switch roles every 5 cycles or approximately every 2 minutes. This regular rotation helps maintain the effectiveness of compressions, which is crucial for blood circulation. For instance, if you're doing CPR with a partner, set a mental timer to switch every 2 minutes to keep compressions strong. Remember, fatigued compressions are less effective, so planned switching is vital. Question 20. What is the first step you should take when approaching an unresponsive child or infant whom you did not see collapse? A. Call 911 immediately. B. Begin CPR, starting with chest compressions. C. Perform 5 cycles, about 2 minutes, of CPR before calling 911. D. Attach an AED. Answer: C. Perform 5 cycles, about 2 minutes, of CPR before calling 911. This question assesses the perform first, call fast guideline for pediatric victims. The concept is prioritizing immediate CPR for children and infants who likely suffered a respiratory arrest first, providing vital oxygen before calling for help. If you find an unresponsive child or infant whom you did not see collapse, you should perform 5 cycles of CPR, which is about 2 minutes, before calling 911 or activating the emergency response system. This initial CPR addresses the common respiratory cause of cardiac arrest in children. For example, if you find your baby unresponsive in their crib, start CPR immediately for 2 minutes, then call for help. Question 21. What is the minimum number of chest compressions per minute for infants? A. 60 compressions per minute. B. 80 compressions per minute. C. 100 compressions per minute. D. 120 compressions per minute. Answer: C. 100 compressions per minute. This question tests your knowledge of the minimum compression rate for infants. The concept is maintaining a fast, consistent pace for effective blood circulation regardless of age. Similar to adults and children, the The minimum number of chest compressions per minute for infants during CPR is 100. This rate ensures that enough blood is circulated to the infant's vital organs. For example, when doing CPR on a baby, make sure your compressions are delivered at a rapid tempo, aiming for at least 100 pushes every minute. Keep that rhythm quick and steady. Question 22. What should be done immediately after delivering a shock with an AED? A. Reassess the victim's pulse. B. Turn off the AED. C. Resume chest compressions immediately. D. Remove the AED pads. Answer: C. Resume chest compressions immediately. This question focuses on the crucial action immediately following an AED shock. The concept is minimizing hands-off time during resuscitation. Immediately after delivering a shock with an AED, you must resume chest compressions without delay. Do not pause to check for a pulse or breathing, just restart CPR. For instance, as soon as the AED delivers the shock and says "shock delivered," you should be ready to put your hands back on the chest and start compressions again. The goal is to provide continuous high-quality CPR with minimal interruptions. Question 23. You are alone and find an unresponsive adult victim. After ensuring scene safety, what is your next immediate step? A. Check for a pulse and breathing simultaneously for 5 to 10 seconds. B. Open the airway and deliver 2 rescue breaths. C. Activate the emergency response system, call 911. D. Begin chest compressions. Answer: C. Activate the emergency response system, call 911. This question assesses the proper sequence for a single rescuer encountering an unresponsive adult. The concept is call first, fast, for adult sudden collapse. After ensuring the scene is safe and determining the adult is unresponsive, your immediate next step as a lone rescuer is to activate the emergency response system by calling 911. This is crucial because adults in sudden cardiac arrest typically need defibrillation quickly. For example, if you find an unresponsive adult, tap and shout, confirm no response, and then immediately call for help or send someone to do so. Question 24. What is the most common cause of cardiac arrest in children and infants? A. Heart attack. B. Stroke. C. Respiratory arrest, breathing problems. D. Sudden cardiac arrest. Answer: C. Respiratory arrest, breathing problems. This question targets a key difference in the common causes of cardiac arrest between adults and children. The concept is understanding the underlying cause to inform appropriate initial actions. In children and infants, the most common cause of cardiac arrest is respiratory arrest, meaning they stop breathing first, which then leads to their heart stopping. This is often due to conditions like choking, asthma, or drowning. Unlike adults, where heart problems are common, children's hearts often fail due to a lack of oxygen. This is why immediate rescue breathing and CPR are so vital for pediatric victims. Question 25. When giving rescue breaths to any victim, what is the best way to ensure the breath is effective? A. Give very quick, forceful breaths. B. Observe the chest rise and fall. C. Listen for air escaping through the mouth. D. Deliver the breath for 3 to 4 seconds. Answer: B. Observe the chest rise and fall. This question focuses on how to confirm the effectiveness of rescue breaths. The concept is ensuring adequate ventilation during CPR. The best way to ensure a rescue breath is effective is to observe the chest rise and fall. You should see a visible chest rise as you deliver the breath, indicating that air is entering the lungs, and then see the chest fall as the air leaves. For example, when you give a breath, watch the person's chest to confirm it visibly lifts, showing the breath went in. If the chest does not rise, you may need to reopen the airway.